presenters today. We had a great amount of just learning opportunities. I know I personally have learned so much. I want to open it up to questions now. We've received quite a few questions over the course of the day, so we'll get to those. But I'd like to encourage everyone to join the discussion, ask some questions. They're happy to field any general questions you may have. But again, we aren't giving out the specific medical advice. So try to limit those in your questions. And we want to just run through this. We have about 20 minutes left. So we'll try to get to all the questions. And the first question we're going to start with, sort of a pair of questions, just sort of out to the group. Is one, range of motion fully restored after a hip surgery? As well, is there any downside to delaying a hip surgery?
So I guess I'll take this question. So range of motion after surgery. So it depends on what you say normal. Is it normal in comparison to what they had when they were 20 years old, or is it normal later on? So hip replacement surgery will improve range of motion. But to what extent is quite difficult to tell from patient to patient. So the reason for that is more than just the joint itself. So around the joints, we have our ligaments, our tendons that I had spoken about, and some of those can get contracted. You can imagine that if someone has a hip arthritis for years and years and years, that these ligaments and tendons get contracted more chronically over that course of time. So just by replacing the joint, you still do have those contracted muscles and tendons that have to be stretched slowly over time. And so it's a slow and continual progress to increase that range of motion. And you do improve it, but to what extent is difficult to tell from patient to patient. John, sorry, the second half of that question,
so forgetting. What's the downside to delaying a hip surgery?
Oh, right, okay.
If there are any.
Right. Yeah. So the downside, there's a few of them. There is a downside that just like the one difficult case that I had shown, the longer you delay it, there is a risk of losing bone. And us as orthopedic surgeons, we use that bone to recreate the joint. So the less bone that there is, it can become technically more difficult. So that's from the surgical standpoint. Now, from the patient standpoint, the delaying surgery and having chronic pain of that hip joint can lead to other issues in terms of decreased quality of life, depression, and there's many other aspects to it as well from the patient as a whole when we look at them.
Beautiful. Anybody else? Very well said, Dr. Schwarmer. So the next question has to do with sort of some of the chemicals and drugs you can take. Thoughts about use on zoleronic acid, calcium supplements, and vitamin D. What are some of the things that people can take to better sort of cope with the symptoms of hip issues?
I can certainly speak a little bit to that in the sense of osteoporosis. So I think, as I mentioned, important to get enough calcium in your diet for bone health and to maintain or help maintain bone as much as possible. We know that calcium in the diet has less of an effect on blood levels of calcium, so it's sort of more smoothly absorbs into the blood. It doesn't peak the levels, and there's a concern that peaking the levels up with taking a supplement that's not embedded in food may have potentially harmful effects over time. Again, that's a bit of a contentious issue, but if you can get calcium in your diet and you can get enough of it in your diet, then there's not a lot of additional benefit from taking a supplement. So I think that's kind of one thing. And again, that's for the majority of people. Some people, you might need to talk to your doctor individually and see if they would recommend an extra supplement for you. But in general, diet is best there. Vitamin D, really what we know is anywhere from 400 to 2,000 units a day seems to be reasonable for the average person. There are some people out there that might need more. And again, that's sort of an individual talk to your doctor sort of thing. And if you've been known to be vitamin D deficient in the past or have major risk factors for that, then you might need more. Calcium and vitamin D together don't necessarily lower the risk of breaking bones. There's some debate about that, but a lot of the biggest studies, and when they put together studies that have been done and analyze them all together in a big group, they've found that, you know, depending on how they're analyzed, they probably don't reduce the risk substantially of fractures. If they do, it's probably reduced on about the amount of 10 to 15%. Whereas segueing into the question about zoledronic acid or medications to lower the risk of, well, I think it was just asked about hip health in general, but I'll talk to it from a sort of osteoporosis fracture standpoint. When we think about medications, lowering the risk of fracture, depending on the type of fracture and the type of medication, most of them lower the risk by about 40 to 50%. When we think about spine fractures, some of them like zoledronic acid lower the risk by about 70%, whereas medications aren't as good at preventing hip fractures. So usually they only lower the risk by about 25 to 40%. And just to back up a little bit, because people had asked about zoledronic acid, but what actually is that? It sounds pretty crazy, a type of acid, but it's actually just the way that the medication is formulated. It's acidic, and its other name is Aclasta. That was the trade name. It's now been around for about almost 15-ish years, and it's now generic. But basically what it is it's a type of medication that stops the cells that dig up the bone from doing so and helps to harden the bone over time. And so it's one of our mainstay treatments for osteoporosis and preventing fractures. Some people might be familiar with weekly pills that can be used for osteoporosis, and it's a cousin of those that's actually given once a year through the IV. So I'm going on a little segue here from the question that was asked, but this is very much so medications can reduce the risk of fracture, and that's been shown in a number of trials, but they might not be appropriate for everyone. They're most appropriate for the highest risk people. So if that's you, if you've had a fracture or think you might be high risk, then that's something to absolutely talk to your doctor about and potentially go through the different options.
Awesome. Thank you, Emma. And the next question, we're going to weave this in. You know, sort of, if you're drinking alcohol or you're smoking cannabis, can have those have any negative effects on your sort of prognosis or the any let's say issues with other drugs that you might be taking to deal with osteoporosis and hip-related injury?
I suppose if you're drinking alcohol and smoking cannabis, you run the risk of falling down, and you better find out what your bone mineral density is before you participate in both activities. But from patients that we see at clinic, oftentimes they will ask us about alcohol and whether or not they can take the alcohol in association with the drugs we use to treat rheumatoid arthritis. The advice we give them is that you do everything in moderation. So if someone is drinking their brains out, that's not going to help them anyway. So they may ignore their joint pain when they're drunk, but it doesn't help. So moderation is important, and moderation is important if you're going to be using cannabis products too.
Anybody else? Beautiful. I think you summed it up nicely. I have a few questions about sort of the length of the wait for hip replacement surgeries. Maybe you could talk about why we have like we have a person saying that they've waited for 2 years for replacement, and another person saying that they've been waiting a long time as well. Maybe we could talk a little bit about sort of the expected wait time and why that is the case.
So, I mean, this is a difficult question. We're in a difficult situation. You know, it's probably not easily answered here on this forum. It's difficult. If we had unlimited resources, we wouldn't have a wait list. So, you know, at the end of the day, you know, we're trying our best to get through as much as we can with the resources that we're given. We have fantastic group of surgeons here that are working hard to do as much as we possibly can. You know, limitations come from the resources given, and at the end of the day, you know, we're in a difficult time right now. You know, we're in the middle of a pandemic. We don't know if tomorrow we're going to be stopping surgery again. So, you know, at the end of the day, we're all working hard. We respect, we understand, and we feel for each one of our patients who come in and tell us how long they've waited. We're trying our best, and quite honestly, that's the best answer that I can give at this point.
Well said, Dr. Sharma. Now, the next question, we're going to talk about a little bit, maybe this is back to you, Raj, a little bit about labral repair. So if you have a detached labrum, would that affect future hip arthritis, or maybe require a hip replacement in the future?
Yeah, I mean, this is really a clinical question that you should definitely ask once you have a consultation. Because the trouble is, it's not an easy direct statement. It's not A causes B. There's a whole bunch of other factors that can be involved. Sometimes the answer is yes, if it relates to a pre-arthritic joint, or the answer could be no, if it's trauma related. So it really depends on the cause, and really once you understand what the cause is and what the imaging looks like, and you can better answer that question on a case-to-case basis.
And there are quite a few sort of direct medical questions very similar to that. And as Dr. Raj Sharma made note of, you know, we can't really be answering those kinds of questions in this form. So here's something a little bit more general. Is there a link between bone health and muscle tightness? Do very tight muscles around the hip area affect the overall health of the hip?
So I'll try to answer this as well. You know, I think we've had some great talks talking about bone health in general, and I think the key behind it is, as we heard, is with the top 5 items to improve bone health, exercise and weight bearing. So tight muscles around hip joint don't necessarily change the outcome of the hip, but certainly exercising, stretching. And just like John, you said, the yoga, tai chi, any of those type of things to help, you know, continually to make and stretch that hip joint obviously does help.
Beautiful. And
John, if I could just add a comment there. One of my good colleagues, Dr. Tish Doyle-Baker from kinesiology at the University of Calgary, showed us a slide a number of years ago at our annual retreat where she had pictures of an MRI scan, a transverse cut from the thighs of a 70-year-old triathlete and a 74-year-old non-exercising male. And the difference between, and they had a 40-year-old as well, the difference between the 40-year-old and the 70-year-old triathlete was that there was some more fibrous tissue in the muscle of the 70-year-old. But when they showed the 74-year-old's thigh, it was fat for about 2/3 of the volume of the thigh, and the muscle had deteriorated significantly. So I think what that adds to is the comment that Emma has made about exercise is really important for maintaining balance and strength and supporting the bones that are underneath the muscles. So anyone who, as you get older, obviously cardiovascular exercise is important, but resistance exercise to retain muscle bulk and strength as much as you possibly can and to help with balance are really important.
Beautiful, beautiful. Now, this is about the anterior surgical approach. One question, is it available across Alberta? Like, would people down in Lethbridge have access to it? And maybe you could talk about the difference between your approach, Raj, and sort of what the other approach is.
Yeah, so you just have to contact the local clinics to find out if it's available in your area. You know, we're working hard to increase the number of procedures being performed, but you know, that increases slowly over time, and we've made great progress so far. You know, in terms of the difference between the approaches, I hope I was able to cover that in the talk. You know, it's essentially just a different way of getting to the hip joint.
Mm. Yeah, that's what I was thinking. So, you know, is there a your post-surgery, is it possible to have an infection from the surgery years after the surgery?
Yeah, infection is always a possible complication. So we looked at our Alberta data and all of Alberta. It matches that of everywhere else, less than 1% risk of infection. That can happen. Highest risk of infection after any surgical procedure, regardless if it's hip, it's knee, whatever it is, within the first 2 years is the highest risk of infection. After that, the risk of infection does reduce, but it's never at zero. There's always a chance of having infection years and years afterwards.
Okay,
and it's not necessarily from the surgery itself, but not necessarily from the surgery itself. I should just comment upon. The more years you're away from the actual procedure, there's other causes that can seed the joint that can cause infections.
And it seems like a lot of questions are coming in your way. So you get your hip surgery, after it's done, how long is sort of the life of that implant good for?
Yeah, so a really good question. So in about the year 2000, some of the technology changed whereby we were using a different polyethylene, which is the plastic liner inside the joint. That has completely revolutionized the length that the replacements last. So currently, our data that we have is approximately 25 to 30 years. About 70 to 75% of the joints are still lasting. So we just don't have data beyond that at this point. So it's lasting for a long time. I think right now, when a patient asks, I think 25 years is kind of a good ballpark figure. But again, the data still out because the technology is lasting longer and longer.
That's beautiful. When I get my hip replacement, I'll be happy to walk on that for 20 years. This is a question about mothers that have children. Do they have an increased risk of fracture? Is there some correlation there?
I can probably take this one. So yeah, good question. And we do know that at the time of pregnancy as well as lactation, there's lots of calcium mobilized out of the bones because that's needed for the fetus or for the breastfeeding baby. So people actually do have a reduction in bone density and perhaps bone quality during that time. That usually improves over the years after weaning, after lactation is done and pregnancy is done. And it's not something that we're usually measuring on a regular basis because even though bone density scans have a really low level of radiation, it's still not something that we want to expose a pregnant woman to. So we're not usually doing scans in pregnancy. But we do know that typically, yes, there is bone loss. Yes, it usually gets better. I haven't seen any data in older women to suggest that previous pregnancies have a strong impact on fracture risk. Of course, thinking about a child's risk after if their mother has had a fracture, then that is a risk factor. So not necessarily because of the pregnancy, but because of genetic factors that make us more likely to break a bone if one of our parents has.
Beautiful. Now, maybe a follow-on question. If you fracture one hip, does that sort of predispose you to fracture another hip?
Yeah, that's a good question. What we do know is that if you've had a fracture, your risk of having another one, any fracture, not just hip, is higher, and it's specifically higher in that year to 2 years after the first one. And then it remains even maybe 1.5 to 2 times higher than the general population for the rest of your life. So yes, if you have had one hip fracture, you would be more likely to have another one than someone who'd never had a hip fracture. But whether one hip fracture predisposes to another hip fracture specifically rather than fractures at other sites, I'm not aware, and I don't know that there's any good literature answering that question out there.
Okay. And then maybe the last question, in terms of your athletic life, you're a younger person requiring, potentially requiring a hip replacement surgery. Is this something that they should do when they're young, or wait until older? This is sort of the other side of the question asked earlier.
So I think the right time to do a replacement surgery is when you failed all non-operative treatment, when you're basically at the end of the line, and there's no other choice, and the quality of life is suffering enough. I think that's the right indication for it, regardless of age. I think, but it's important not to jump into surgery without having to go through the process of the non-operative treatments, which are important as well. Because you got to remember, surgery, it still has complications. You know, as good as a procedure can be, you know, there's always a risk of something happening after surgery or during surgery. So, understanding those risks, again, surgery is always the final treatment option. And so, to making sure you go through all those treatment options beforehand is important.
Beautiful. And with that, folks, we're going to shut it down here. First of all, I'd like to thank all of our presenters. We had Dr. Emma Billington, Dr. Liam Martin, Dr. Raj Sharma, and Shannon Falsetti. All wonderful presentations, and we learned so much today. So special thank you. A special thank you to Dr. Donna Wood, a close friend, and her family, and the Wood Joint Research Fund for their ongoing support that makes this all possible. If you'd like to learn more about how you can support this and other cutting-edge research that takes place at the McHague Institute for Bone and Joint Health, please contact the Institute directly at mchague@ucalgary.ca. And lastly, you'll receive an online survey in the next few days about the event. Please fill it out, and we very much appreciate your support. And most importantly, during this time, you know, we're all sitting more, we're all like, you know, sort of locked down in the house. You know, it's important to take care of your health. And like the presenters talked to you about today, yoga, staying mobile, staying moving, those are all very important things, and all things we can very easily do in the confines of our own homes. So thank you all very much for tuning in, and we'll see you at the next Wood Forum. All the best.